Hello class, here we go. We are going to do the second recording for this semester and we're going to do emergency preparedness, informatics, and quality improvements. So we are going to talk about emergency preparedness first. First of all, emergency preparedness is part of health promotion. It's important that we realize each individual is enabled to have an increased power and control over their own health if there's health promotion that's encouraged. That's something that we need to strive for as caregivers and as nurses. So let's talk about what role does the nurse play in health promotion? Well, number one, education. Nurses are very important in the health education aspect and teaching people, educating, evaluating, and screening. Secondary role is detection and treatment. We need to find what the problem is and what we're going to do about it. Tertiary role, at this point, a lot of times we're dealing with chronic illness, and by then we are just trying to treat the symptoms, and we're also trying to provide an increased quality of life as much as possible. Let's talk a little bit about what is the nurse's role in disaster planning. Keep in mind that we're planning at this point. Who better in the community knows about the needs than the nurses? And who better is able to meet the needs of the people in the community? The nurses. So let's be sure that the nurses are involved in the planning process, because they're going to be the ones that can provide the most information for the entire process. So let's talk about health literacy. So even though we have so much information available in a heartbeat, our cell phones, our computers, we're seeing that people know a lot less about their health right now than they ever have. And it's important that we teach the basic health care and basic understanding to the people in the general population. So we learned from COVID multiple things, but one of them, we saw that the indigenous and the black population are highly underrepresented and do not have the type of health care that they need for the best outcomes. So health literacy is a problem there. Let's move a little bit here and talk about what's the difference between specialized and primary care, and what are some advantages and disadvantages. Well, I can tell you, if I'm having symptoms of a stroke, I sure hope that somebody will get me to a hospital that has neurosurgeons, cardiovascular surgeons, and neurotrauma surgeons potentially. Specialists do have a role, and they have the need to take care of patients at certain times. However, there are many things that can be taken care of by primary care. Specialists charge more, and specialists are located in specific areas, which usually don't include the rural areas such as Wyoming. So those are some advantages. Some disadvantages and advantages. Advantage of primary care, if for the most part you're a pretty healthy person, it's pretty obvious that a primary care doctor can keep on top of that and take care of you. So that's something else to keep in mind, the difference there. Telehealth. What is telehealth and why do we have it? I think we all know what it is at this point. Let's think of the advantage in rural hospitals. If somebody's having symptoms of a stroke or somebody's having symptoms of a heart attack, they can easily dial into a specialist in Denver, I guess we're in Casper, so we have some of those specialists here. But if you need somebody at Swedish Hospital in Denver, or you have a high-risk pregnancy, it's super important that you can get into a neonatologist if you have problems with a newborn that's being born too early. Those are just a couple examples, and telehealth is good. During COVID, telehealth was a lot of the rules that apply to telehealth were let down, but I believe that we are converting back to telehealth is going to be limited. Keep in mind, as a nurse, You can only practice in the state where you are licensed. That includes telehealth. So if you are licensed in Wyoming and you have a patient in Colorado that wants to do telehealth, you can't cross the border. There are a few exceptions to that, but for the most part, keep that in mind as a nurse, unless you have the compact license. So you need to practice in the state where you are licensed. So keep in mind that a person's perception of their needs is 100% real to them. So if somebody is sick at midnight on a Friday and they felt sick all day long, but they waited till midnight to go, where are they going to get health care? Where are they going to get help? It's going to be in the emergency room. That is their perception. And they need access to health care, and they need to be understood and listened to. So what role can we play as nurses in that? Educate again. We can help them understand that it's important that they have a primary doctor, that they get the care that they need prior to it being an emergency in the emergency department. It increased costs, it used resources, and it's just not necessary. They're not going to get consistent quality health care at that point. We talked about EMTALA. That's the federal law that states anyone who accepts Medicare funds, which are the majority of the healthcare facilities. Just an example here in Casper, Mountain View Hospital used to not accept Medicare, or they wanted to stop taking emergency patients because of the pay and the cost with it, but because they take Medicare, they had to continue to accept those patients, and I don't think that was something that they were able to do financially, and that's why they sold out, and Banner now owns them. So EMTALA is something you cannot be turned away if you have a medical emergency or if you are in labor, regardless of your ability to pay. All right, emergency management. Let's talk about for a minute the 4 phases of emergency management. You have mitigation, either to prepare for an emergency, the potential hazards, and try to prevent it. And if it does happen, you try to minimize the risks and prevent further damage. Then you have preparedness. Obviously, this is a very important phase. Nurses take part mostly in the preparedness part. In planning for the emergencies that may come. Response. Truly, when it comes to an emergency, like say a tornado or a horrible blizzard, something like that, the nurse is not going to necessarily be on the front line with that, but they are going to be involved in the care. So their role goes back to the preparedness. And then recovery. That's, again, nurses are going to step in and help recover. I think we know a lot about that if you're looking at the Maui fires at this point. So reverse triage. What is reverse triage? When you have mass casualties from some sort of accident, when you go in and you have limited resources and you have a lot of people to take care of, you've got to put your focus where you can do the most good. So if you have somebody with a punctured lung, they've got a gaping abdominal wound or a side wound, but they still have a pretty good chance if you can just help to stop that bleeding. And potentially if they have a pneumo forming, you can try to do something to put pressure on that. That's more likely that you're going to make a difference versus somebody who has multiple traumas, is maybe having Kussmaul's breathing. You're not going to see the chance of them recovering versus helping somebody with a respiratory. And on the other end, if you have somebody that's wandering around, potentially a pretty bad broken arm, but they're wandering around in shock, they're also not going to be your top priority. You need to reverse triage. You need to figure out where can you put your resources to do the most good for the most people. Remember the acronym for triage, the simple triage and rapid treatment. In an emergency, you need to just stabilize. That's where it's so different from what we do as nurses. We tend to, the holistic, we want the long-term outcome, but at this point you got to act like a parametric. How about a paramedic? And take care of the patient right there. All right, let's move on to informatics. Why in the world do we have electronic charting? There are lots and lots of benefits. I will tell you, one of the benefits most people will say is that it does not save them time in charting. It doesn't. But one huge benefit to it, and the biggest thing what we strive for, which also the Affordable Care Act, the ACA, It also put pressure on hospitals to improve patient safety and patient care safety and efficiency. We're required to work more with the electronic medical records. So that's one of the things, and it does improve all of that. But then keep in mind, too, the multiple disciplines that can simultaneously have access to the same information. When I graduated from nursing school, you had the mentality, if you had a chart and a doctor walked in, you got out of that chair, you gave him the chart, you gave him your chair, you gave him your pen, and if they wanted a cup of coffee, you got them a cup of coffee. So nowadays, you don't have to give the chart up, and usually we don't give our chairs up or our pen either. So it is important that more people can look at that record all at once. The pharmacy knows what's going on in real time, where the x-ray or the radiology, they know what's going on in real time. So something to keep in mind is the electronic health record or the electronic medical record, usually used interchangeably. Typically, one difference you will see is the EHR is typically more mobile, and it can, I'm trying to get this backwards for you while I tell you real quick. Yeah, EHR is more portable, meaning Cerner through Banner is portable because you can access Cerner at multiple Banner facilities versus, say, one of the docs in town has Cerner that they bought for their office. It's not as portable. So EHR would be Cerner at the hospital versus EMR would be at a doctor's office where it's not nearly as portable. Patient education. Think about the information you can get off of the EHR that you are able to share with the patient. Number one, it's consistent information between caregivers. And number two, it's super important that you're documenting it right there in the record in real time that you've given them this information. It's consistent, it's reliable, and it's documented. Clinical decision support system. This is basically an algorithm that is set up in the electronic medical record that, based on the patient, specific to that patient, here's the order sets that are probably the best, and you're able to provide the best evidence-based practice care for that patient in this situation. So that's pretty useful, obviously. Something else, this goes to what Nick talked about. You can track some of the trends that are happening and provide better evidence-based practice that you can provide to these patients because you know what's going on. You know what the outcomes are. CLABSI and CAUTI, those are two examples of where you've been able to track trends, make changes. We have far fewer catheter infection and central line infections because of the CLABSI and the CAUTI, which go back to the ability to trend those happenings. Okay, quality improvement. Why do we care about quality improvement? What do we need to do? We're doing our job. Let's just keep doing it. Well, quality improvement will never go away, and it is absolutely necessary. Changes that have been made because you're continually monitoring and evaluating. Going to give you a quick story on this. Quality improvement in our unit, on the dialysis unit that we were doing. We had the practice of cleaning the sites with just, let's go back to ChloraPrep. We were cleaning them with just ChloraPrep. And we were finding that patients were starting to have rashes and outbreaks because the ChloraPrep was irritating to their skin. Well, we discovered one of the things there is we weren't letting it dry long enough before we put an occlusive dressing on it. So the ChloraPrep, the chlorhexidine, was being held on their skin, making it irritated. Well, we stopped doing that. Well, people were still having breakdown from it. So we had to quit using ChloraPrep. We went to using betadine and alcohol. Well, then we started to have infections. And we're like, well, shoot, we haven't had infections for a long time. So we changed our practice again. And we did where you had to wipe with alcohol, then you had to wait, then you wiped with the betadine, then it dried and you could cannulate the patient. That's a necessary thing that you can do to show quality improvement based on the information you have. So informatics, you can track it. We talked about that. Let's talk a little bit about system errors. The majority of medication errors that I have been around in my profession is a systems error. The way the system is set up leads staff to be at a risk for error. So don't always jump right to, well, that nurse is lazy, that nurse was in a hurry, that nurse didn't pay attention. It could be more than that. Let's look at the system and let's see what we can do about it. What is benchmarking? Benchmarking is when Wyoming Medical Center starts comparing some of what they are doing. Let's go to Rapid City. Let's look at the Rapid City Hospital. They're comparing what they're doing to Rapid City and making decisions based on the benchmarking so that you can have standards. Are they having better success in one area and they're seeing less success in another area? And what can be done about that? What can we do about that to improve patient outcomes? That's benchmarking, when you look at your neighbor to see what they're doing, to see if we can make changes. Standards of care. Make sure that you are aware of what the standards of care are. It's important that, just a second, I've got to pull that up here so I get it right. Think about when you are going to look at a problem. You're going to determine, first you're going to say, okay, what's the structure of how it's set up and how it's supposed to work, and then what's the process, how is it carried out, how do people do it, and then what are the outcomes. You're not going to immediately, when you want to assess something that's happening that's maybe medication error or a patient satisfaction problem, you're not immediately just going to look at it and go to the outcomes and say, well, that's what it is. You need to start and evaluate the whole process. That's what standards of care are. You need to look at that so that you can have high quality performance. You need to look at the whole process. Six Sigma, I'm not going to go into that very much. I have a video posted on that, and I would suggest that you watch that so that you understand Six Sigma. Six Sigma is a process that has improved a lot of healthcare by looking at the whole process from the start to finish, steps that can be eliminated, steps that need to be tightened up and be more efficient. Okay, quality improvement. What is the difference between intra-professional and inter-professional? Intra-professional is when a group of nurses, a group of surgeons, a group of social workers, whatever they be, they get together and try to look at some of their standards of care and things that could be changed to improve patient outcomes. By doing that, they're also doing peer reviews, they're doing audits, they're looking at the outcomes of what's happening and determining what changes and what necessary steps need to change in order to improve it. So that's important. What is interprofessional? That's when you have doctors, nurses, social workers, whatever, are all working as a team to try to improve the process. You will see utilization review, and that is what they do. They look at the whole process to see where we're wasting money, we're not doing what we need to do, we're doing the wrong thing. You just look at the whole process to see if you're doing what's best for the patient for outcomes. We already talked about DRGs and the disadvantage. You are discharging quicker and sicker, and you're having more hospital readmissions. Therefore, it's not cost effective for the hospital. Again, worse patient outcomes, that's what you want to think about, but it is financially a downside for the hospitals. What's a near miss versus a sentinel event? What is a sentinel event? A sentinel event is when there is a serious adverse outcome because of a mistake that is made. Prime example of this is when the left leg is operated on instead of the right. Because of sentinel events, that is where we began to see the timeout period that happens in the surgical suites. They do timeout periods, and they have so many. It's like a flight checklist that the pilots are going to use before a plane takes off, which we all are glad that they do, because we don't want to get on a plane when steps are missed. So that's important that you know that. Let's see here. Root cause analysis. You might just look that up a little bit, not a huge deal, but it's something that you will find when you are on committees, when you are in the profession, you'll be on committees, and you try to get down to the bottom layer of why this is happening. What is the root cause for something that isn't working as efficiently as we want it to? You need to know about that. How do you know what website is reputable? Look that up. Pay attention to that. Can I just believe anything I see on TikTok? Can I believe anything I see on YouTube? Can I believe anything that I see on the Joe Rogan show, or if we even want to say something that I see on CNN? You can't always believe everything you hear. You've got to know what's reputable. Pay attention to that. So what should the outcomes be from a medication error? I want to throw out to you and propose to you that it is important that it is not punitive. A punitive response is going to lead to people hiding things, people avoiding handling situations. I want to back up real quick. When I did Sentinel event, I missed talking about a near miss. Near misses are an example. I withdrew a medication from the Pyxis. I went to give it to the patient. I did all my checks at the Pyxis. I got into the patient's room. I did my checks again. Dang it. I grabbed hydralazine when I meant to grab hydroxyzine, but I caught it at the bedside before the patient was harmed. That would be considered a near miss, and those are things that need to be tracked. Don't need to be punitive. You caught the mistake. If you begin to make everything punitive when people make mistakes, they're going to hide the mistakes. They're going to minimize the mistakes, and they're not going to learn. It's best that medication errors be handled with education. Like I mentioned before, it usually comes down to the process and the way that things are set up. So that's the information for now. You guys have a great weekend, and we will see you on Monday.